I'm a vision correction surgeon, and I'll try not to hurt your feelings too much on this one. There's nothing wrong with waiting to have vision correction. Often patients will come in, they've spent years working up the courage or the confidence to finally have their eyes corrected, and then we find out in clinic that their prescription's actually not stable. It's been shifting over time. Look, it doesn't make sense to have an elective eye surgery if we're not going to have longevity with the outcomes. We want to be thinking about what's the immediate outcome after surgery, but then also how is your vision going to be in 5 or 10 years down the road. So usually in these instances, I'll recommend waiting 6 to 12 months, maybe a year or two, even longer than that. Once we have stability of prescription, if someone's a candidate, then we can proceed with surgery. Not everyone is a candidate for vision correction surgery. I know this is going to be hard to hear for some of you. I have this come up from time to time. A patient comes in, they're so excited to have LASIK, they're so excited to have PRK, they're so excited for EVO ICL surgery, and then I have to deliver the bad news. Hey, for X, Y, or Z reason, and there's a lot of different variables I consider, you're just not a great candidate to have your eyes corrected. I've had patients burst into tears. Some patients get very upset with me. How come I can't have surgery? Listen, that's life. Life isn't fair. Not everyone is a candidate for everything. We want to make sure we have your eye and your vision's safety in mind. It doesn't make sense to do something where you could potentially have complications down the road and suffer issues. So if you're not a candidate, I will always be honest with you and tell you that. And finally, there's nothing wrong with continuing in glasses and contact lenses. But if you're someone, you're losing your glasses, you can never get the prescription correct, you don't like how they sit on your face, contact lenses, you have a hard time putting them in, taking them out, or maybe they rotate on the surface of the eye, maybe you're becoming contact lens intolerant, then yes, you may be a great candidate for LASIK or SMILE or PRK, refractive lens exchange, EVO ICL. There's so many different forms of vision correction. If you're interested, come on in for a consult. I'll take a look at your eyes and we'll figure out what you qualify for.